It's a people, it's a community, it's a life, it's a heart, it's a spirit.
Parents of gay children say, I want my son, my gay son, to have the same opportunity to come to me and say, hey, Dad, I'm getting married, as my non-gay son or my non-gay daughter.
The heck would you want a picture of a tattoo of $1,000 on your penis for?
You might just need to satisfy yourself sexually alone at that point.
Do I regret it? Not one bit. Did I think that I would actually take it the next step and do it again?
And what goes into their life, how they handle it. There are 12 houses, and each one of those houses has a particular function.
Look into yourself, think about it, and just be whoever it is that speaks to you.
Hello and welcome to Talking About. Tonight we are coming to you live on March 1st, 2005, and we're talking about chiropractic care, and my guest is probably a familiar face to our regular viewers, Dr. David Reich. Welcome back.
How are you? Thank you very, very much for inviting me back to your show.
Oh, I'm glad to have you. If viewers didn't like you as much as they do, well, you wouldn't be here right now.
Thank you, thank you.
Okay, well, I just gave the show a broad title, Chiropractic Care. Could you give us a little bit of the basics on exactly what chiropractic care is?
Okay. Most people, when they hear the term chiropractic care or chiropractor, they think along the lines of back pain or neck pain. Chiropractic care, the first chiropractic adjustment was given in 1895 by a Dr. Daniel David Palmer, D.D. Palmer. And he was a magnetic healer at the time. At the time, you have to understand what the status of healthcare was. People used to put leeches on, they went to barbers and got cut, and they used magnets and they used herbs and other things as well. And Dr. Daniel David Palmer was a magnetic healer. And one day, the custodian, which worked in the building, came into his office, and he had explained to Dr. Palmer that a couple of years ago he was lifting up something, and he heard a crack coming out of his neck and his upper back area, and shortly thereafter he began to lose his hearing. So Dr. Palmer looked at his neck and looked at his upper back, and he found a couple of bumps on his spine which didn't belong, and they were tender. And in a very unscientific method, laid Harvey Lillard, who was the janitor, on the floor and pushed those bones back into their normal position, or tried to. And within a very short time, Harvey Lillard's hearing returned. And that was probably the first chiropractic adjustment as we knew it. And at the time, Dr. Palmer was of the opinion that he found the cure for hearing loss. So what people would come to him with problems with hearing, and some people would show certain signs of improvement. Others may not show improvement in hearing, but other things were getting better. Their headaches were getting better, their back pain, their neck pain, their stomach pain was getting better. And after a while, his name became very popular and very common, and that's the beginning of chiropractic. So chiropractic was, in the beginning, was never intended solely as a therapy for pain. Over the course of the years, chiropractic was taken over, the profession of chiropractic was taken over by his son, B.J. Palmer, who really developed chiropractic. He started the first chiropractic college. He had a lot of students which became chiropractors. And the early chiropractors are the reason why we are here today. Now, when most people come to us, again, it's for back pain. And what we concern ourselves with, mainly in chiropractic, is spinal alignment. What we check the spine for is we look for bones which are not properly aligned, and we call these subluxations. When there is a subluxation in the spine, it can interfere with the proper functioning of the nervous system, and have various things can go wrong. There can be pain, there can be lack of function, there can be numbness, there can be a whole host of things which go wrong as a direct result of having these bones out of their normal position. And the reason is that it interferes with the normal functioning of the nervous system. The nervous system is a system in the body which controls and coordinates all the other systems in the human body.
Right, it's sort of the central line that affects everything else.
And as a result of doing a chiropractic adjustment, we're able to bring the nervous system back to the way it should be. We don't make people supermen or superwomen. What we do is we attempt to bring them back to normal. And health is a normal state. Sickness is not a normal state.
Okay. And are there any people who misinterpret or become so sick that they misinterpret the sickness for normalcy?
If you ever watch TV, they kind of convince you of that fact also. You know, you suffer with a normal morning headache, you take this type of medication. If you have an evening headache, you take this type of medication. If you have a headache involving a migraine, well then you take this. Or if you suffer with menstrual cramps, that they consider normal. But the only thing which is normal is health. Health is a normal state, and anything less than health is an abnormal state. And that's what we as chiropractors, we try to restore the body back to a normal state by working with the nervous system, by correcting misalignments in the spine, again, which we call subluxations.
Okay, and just having that introduction out of the way, I do want to invite the viewers to join in this conversation. We are live at 718-460-9802, and we would really love to hear from you with any question that you might have on the topic. Is there a typical patient, or is there a typical situation that might bring somebody to you initially?
Well, most people, when they go to a chiropractor, they're in some form of pain. Rarely does a person ever come to me and say, look, I heard that chiropractic is a good way to maintain your health, and I want you to check me out and make sure that all my bones are back in position the way they should be and give me an adjustment. Most people do come in with pain. And what we like to do is when they first come into the office is we're going to be taking quite a detailed case history, which essentially means asking the patient what's their immediate complaints. We find out any secondary complaints. We then go into the history and find out if they've had these problems before, what have they done for it, what doctors have they seen, what medications have they taken for this particular problem. We also then delve into things like when was the last time you had blood work done, have you been involved in any accidents, falls, injuries, are you presently taking any medications, over-the-counter medications. We talk a bit about their family history. We want to get a full picture of the patient before we begin to examine them so we know what to look for, and more importantly, what things we can treat as chiropractors and what things we can't treat. And of course, when there is something there which is not a chiropractic problem, such as an infectious disease or a cardiovascular problem, we want to make the proper referral. Many times a patient will come into my office with a particular problem, and I may call in an orthopedist, a neurologist, a physical therapist, a physiatrist.
Which was going to be my next question, is how does your field work in tandem with, I don't know if mainstream is the right word, or just a general practitioner, I suppose.
When I started chiropractic school and when I graduated from chiropractic college, we were not mainstream. Chiropractors were out there in left field somewhere. Over the course of the last I've been in practice now for 24 years, things have changed. We're kind of mainstream at this point, and we work and we cooperate and we work with the medical establishment quite a bit. There are two different philosophies by which we work, but we can work together, and we do work together, and the people which benefit most from this, of course, is the patient, by having the ability to have both doctors, both types of doctors, different types of doctors, working on their health care together.
Okay. Well, you were saying that you do refer back and forth.
We certainly do. I mean, I would not want to live in a community where there are no medical doctors, no orthopedists, no physical therapists, no acupuncturists. We need to work together. The patient is what is going to benefit. Not everything is responsive to chiropractic care. A lot of things are, but not everything is. And of course, we want to have other doctors and other health professionals to help us along with these things.
Okay.
Help us along with the patients.
Okay. Well, we started to mention some common problems. What is there a most common?
The most common thing, of course, which chiropractors do see in our office,
the
is the low back pain.
Yeah.
And that, at any point, 80 to 90% of the population will be affected with low back pain at some point in their life. So it's quite a common problem. We also see neck pain, shoulder pain, knee pain.
Okay, well, starting with the lower back, with it being probably the most common, as you said, is there preventative care or just preventative things to do in daily life.
Okay, we need to discuss here a little bit about the low back and
Okay.
probably a little bit about what we do in society. We used to be four-legged creatures. I hope I'm bringing evolution into this, and I know there's some controversy in this, but from what my understanding is, we started off as four-legged creatures, and over the course of a few million years, we were able to stand on two legs. The human spine has not fully adapted yet to that four-legged existence, and as a result of which, there are certain areas which are structurally weaker than other areas, and as a result of which, that you're predisposed to certain problems. So one of the areas which is weaker, if that's the best term to use, would be the lower back, the lumbosacral spine, and the sacroiliac joints. And things like prolonged sitting, lack of exercise, poor ergonomics while at work, poor nutrition, poor sleeping habits, bad mattresses, a lot of stress in your life will result in certain weaknesses in the low back and eventually trigger a low back situation,
Okay,
a low back pain situation.
And we do have a caller. Caller, just speak in and join the conversation whenever you're ready.
Hi, Dr. Reich, is that you?
Last time I checked.
My name is Harold. How are you tonight? In the course of my work, I'm a locksmith, and I'm developing left knee problems. I pretty much get this when I bend and I stoop. I've gone to various orthopedists, and I'm not happy at all with the results I'm getting. Could you possibly help me at all?
Well, what we would need to do is we would need to, of course, to examine you, but let's talk a little bit about knee pain in the first place. The knee is a very involved joint. There is ligaments, there are muscles, there is cartilage, there is nerves, there's blood supply, there's bones. So one of the things which we'll do as a chiropractor is to check the nerve supply going to the knee. And the nerve supply going to the knee usually emanates from around the second to fourth lumbar spine. That's the second, third, and fourth lowest bones in the spine. And the nerves then in turn go to the knee, and those nerves surround the muscles and allow the muscles to move. So if there is irritation going on to the nerves in the knee, the muscles are not going to work in harmony. They're not going to function properly, and that could be a cause of problems. In addition to that, as a result of various traumas and stresses, we can develop little tears within the knee cartilages, which is called the menisci. There's a medial meniscus on the inside and a lateral meniscus on the outside, and little tears can develop as a result of the bones in the knee being out of their normal position. And with chiropractic evaluation and care, we can determine which bones are out of their normal position and realign them, put them back to where they normally should go. In addition to that, what we like to do is we like to prescribe exercises to help strengthen and rehabilitate the knee. In addition to that, we may use various forms of adjunctive therapy, which may include things like electromuscle stimulation and ultrasound. And then what we also, I feel in my opinion is very necessary, is that we supplement the patient utilizing some form of supplement. Probably the most common we would use would be glucosamine, which in turn is going to help rebuild the cartilage in the knee and help the area get better. Not all knee conditions are responsive to chiropractic care. A lot are, a lot are not, and some of which may require the orthopedic intervention in the form of arthroscopic surgery, or if the case is much more chronic and there's a lot of degeneration going on there, it may require full knee surgery, a complete knee replacement surgery. But chiropractic is certainly a good way to get a start with it, and if it's successful, well, you've probably saved the insurance company about $25,000 on knee replacement surgery and about $8,000 on arthroscopic surgery, in addition to saving money on the MRIs. So the benefit is, of course, to the patient, but also to the insurance company as well. They do save a lot of money by having a chiropractor work on it.
I see. I understand. Are you based in Queens, Doctor?
Yes, I am. I have a very unique situation. I have my office in Richmond Hill where I've been for the last 24 years, but I also have the privilege of being associated with Jamaica Hospital Medical Center, where I'm the staff chiropractor there. And it's a very interesting situation. I get to treat the staff there. I treat the doctors, the nurses, the people which run the computers, the storeroom people. It's a wonderful situation I'm in, and I like the opportunity which Jamaica Hospital has offered me. And it's just a wonderful thing. I enjoy being a chiropractor a lot in Jamaica Hospital.
You've given me a lot of information.
Okay, you mentioned briefly day-to-day work situations.
Okay, well, day-to-day, a lot of times, especially now since everyone sits behind a computer, that's probably one of the greatest stressors I have seen in practice. It has a couple of potential problems. Number one, you're sitting all the time. And, you know, sitting is, it's something which causes the muscles to go weak. And, you know, you're not active, so that'll have its effect on the low back. But what we're seeing a lot more of now are things like neck problems, shoulder problems, carpal tunnel syndrome, elbow problems. People sit in all kinds of crazy positions on their computer. And one of the things I like to do, you know, I like to be part of the solution as well. If I talk with a person and I ask them, all right, I want you to sit down by my computer and show me how you typically would sit. Arrange your chair, and you'll see that people are at the computer like this with their heads like that, the telephone's over here. You need to work on your workstation and make everything ergonomically convenient to you. That, you know, you shouldn't have to reach this far for the phone. You shouldn't have to turn this way while using the computer.
You reach this far for the phone. You don't have a headset. You're
on
the phone with your neck cocked to the side, typing away, talking to the person next to you, talking to the person on the phone.
I mean, it's great for business, but, you know, my job is to not only take care of the patient, but to advise with certain activities of daily living to prevent the problems from occurring in the first place, or to teach them so they don't undo on the outside what we're trying to accomplish on the inside with the chiropractic adjustment. So that's another part of our job. There's a lot of activity of daily living type of counseling which we need to do with patients because of the nature of the work which we do as chiropractors. We also advise patients with regards to sleeping habits as well. Patients, you know, they talk about their mattresses, and one of the questions I ask on my patient intake form is, how old is your mattress? And most people don't remember, but sometimes you get some interesting answers there. Like I had one situation where a woman put down that her mattress was 15 years old. And I asked her, 2 years ago, did you give your mattress a bar mitzvah? And they thought that was pretty funny. But with regards to mattresses, one of the things which we do advise is to get a good quality mattress.
Every how many years?
7 to 10 years is about as long as a mattress is going to last. Also, if you have the kind of bed which uses a box spring, when you change your mattress, you should change the box spring as well, because the box spring has a tendency of giving and weakening as well. And if you put a good brand new mattress, which is a good quality mattress, on a box spring which is sagging, that mattress has about 3 or 4 years, and you might as well throw it away.
Should a mattress be flipped on a regular basis?
When you change mattresses, okay, when you use an inner spring mattress is what we're talking about, the mattress should be flipped once a month. It should be flipped head to tail, so we move that, and then top to bottom. And I advise my patients not to try doing this alone, because if they do it alone, they're going to hurt their back even further. Get someone to help them, and if the other person hurts their back in the process of doing that, well, you know, a good chiropractor.
Yeah, then you get 2 patients.
This is how we do it. You know, we're always feeding ourselves with business.
Okay, and we do have another caller. Caller, whenever you're ready, feel free to speak up and join the conversation.
Hi.
Hi.
My
Welcome.
name is Barbara.
Hi, Barbara.
I've had double knee replacement, 1996, and I'm still having problems walking, pain. Would a chiropractor be useful for me? I also have had a lower back operation.
I'm listening to you, and usually when we see bilateral knee replacements, we're talking people in their 60s, 70s, 80s. You sound much younger. May I ask how old you are?
Well, I'm 59 now.
Okay, and you had it in 1996?
Yes, sir.
So you had it when you were about 50 years old?
Yes.
That's quite young to have that type of surgery, but right now you have artificial knees in there, and it's a total knee replacement. You can be helped by making sure that the muscles on in front of the knee, behind the knee, and the sides of the knees are all working in harmony, that the nerves going to these muscles are working properly, and that way you can have the muscles will be strong and will relieve a lot of pain. And from listening to your history, it sounds to me that you mentioned that you've also have back problems, and you said arthroscopic surgery on the low back, or
No, I had a fusion.
you had fusion. You certainly do have, there's certainly problems there just based on that alone, and certainly I would try a chiropractor. And you know, my advice is, if it's going to work, you'll know if it's going to work probably within the first 3 to 6 weeks of care, that there should be some kind of improvement within 3 to 6 weeks of care, and then if it does improve, then of course you would continue with the care. But that certainly there's hope, there's help, and there's nothing more medically which can be done once the knee replacements are in place, other than the rehabilitation which occurs thereafter. And it certainly would be it would be a good shot to try a chiropractor.
Okay, thank you very much.
Thank you, Barbara.
Thanks for your call. Is that another common story?
We see a lot of patients coming in which have gone through some form of surgical intervention for a problem, and they're feeling somewhat better, but their expectations of what they expected from the surgery are just not there. And they come into a chiropractor's office, and some people are very, very pleased and very surprised at how simple a treatment it is and how much improvement can be made in a very short period of time. You know, once a person's had surgery and it doesn't do what it's supposed to do, they tend to give up. They say, well, there's nothing else that can be done. But that's not the case. There are things which can be done post-surgically, and I certainly would encourage people which are in the same situation, you know, to try chiropractic care, to give it a shot, see if it works.
Okay, and we do have another caller. Caller, whenever you're ready, speak up, join us.
Yeah, hi. I was wondering if you're familiar with Osgood-Schlatter's disease.
Osgood-Schlatter's is it's what's also known as an osteochondrosis of the anterior tubercle of the knee. It usually affects teenagers, mostly boys. And if you feel the knee in the front, right below the patella, below the kneecap, you'll feel a large lump. That lump was actually an area where the bone had died. It had become infiltrated with calcium, and it's formed that. Now, usually with Osgood-Schlatter's, what we find from a chiropractic point of view is that the tibia bone, which is the lower bone of the knee, has come out of its normal position forward or anterior. And we have special correction adjusting techniques where we can actually put it back into place very gently, and the results we get are sometimes near astonishing. As a matter of fact, I have a patient right now, which matter of fact, I'm seeing him, a teenage boy tomorrow, which has Osgood-Schlatter's, and he's doing great with it. And with the results which we get with Osgood-Schlatter's are very, very good.
Okay, did you have a specific question?
Yeah, well, I'm 47 and I've had it since, I guess, I'm a young kid. Is there anything that can be done for someone my age who has that?
Certainly can. Certainly can. Do you still feel pain on occasion, or is the pain continuous?
It's on occasion. I think I probably don't notice it now as much as I used to.
Well, there's certainly things we can do for it. As far as the aesthetics are concerned, the bump on the knee, that's probably not going to change. But what is going to change is the pain the intermittent pain is probably going to be reduced significantly, both in intensity, duration, duration meaning how long the pain comes on when it does come on. Intensity is how bad it is, and then frequency, how often it affects you. So we certainly can be helped with chiropractic care with Osgood-Schlatter's.
Thank you.
Thank
All
you.
right, thanks for the call. Okay, well, we see how other conditions can
Seems to
interplay.
be knee day over here. Everyone's asking me about knees.
Yeah, well, we started with knees, and I
Yeah.
guess everybody just picked
That
up
was
on
Harold's
it.
call, which led us to the knees. But there are other things we treat. One of the things which is very, very common, particularly as a result of the use of computers, is carpal tunnel syndrome. Now, carpal tunnel syndrome is treated medically many times with a surgical release procedure, where what they do is they actually cut away part of what's called the flexor retinaculum, which is basically a ligament which attaches to the distal end of the wrist, which is actually compressing the nerves and the blood vessels in the wrist area. We as chiropractors, what we do is we want to make sure we check to see that the nerves in the neck are working properly, because the nerves in the neck supply energy to the various muscles in the arm, particularly in the forearm and in the fingers. We also like to check the alignment of the wrist itself. Many times, the radius bone and the ulnar bone have a tendency of misaligning, coming out of their normal position and kind of stretching the flexor retinaculum. It's kind of like having a guitar and tightening the end of it, making it tighter, and that squeezes it. So it squeezes the nerves and the blood vessels, and we make an adjustment which helps approximate the bones together, allowing more room for the nerves and the blood vessels to go through, and that gives a tremendous amount of relief with carpal tunnel syndrome without having to go through surgery. And they've done studies using what's called EMGs, electromyography, and NCVs, nerve conduction velocities, and they found that the use of chiropractic care has made tremendous improvements in carpal tunnel syndrome as well. So that's one of the things we treat as well. Another thing which people would not associate chiropractors doing is the temporomandibular joint problem, which are jaw joint problems. A lot of people get jaw pain, they have clicking and popping in their joints, they have jaw joint problems which cause headaches and dizziness.
Okay.
And with chiropractic, there are a number of corrections which we can make on the jaw itself, which helps relieve that problem as well. So these are the kind of things which we treat above and beyond the low back pain, which again is most of every chiropractic practice is the low back pain. A lot of patients come in with headaches. Now, rarely does a person ever come into a chiropractor with a headache as a primary complaint. They come in with neck pain, shoulder pain, low back pain, and in addition to that, I have the quote-unquote normal headaches. I get tension headaches 3-4 times a week. I'll get a migraine headache once or twice a month, or once or twice
a patient
a year.
with.
A patient, yeah.
A
I don't get these things. I get adjusted regularly. I don't have
Okay,
these
and we do have another caller. Caller, whenever you're ready, join in. Welcome.
Hello, Doc. Good evening, Dr. Reich.
Good evening.
My name is Ruben.
Hi,
like
Ruben.
the gentleman who called before I'm also 47. I had a long period of that I ran for a long time, marathoning, constant hitting on the pavement. And what I have now is that my calf muscles, I have like a pulling type of sensation that if I feel that if I take another step, it's like going to tear or something of that nature. Do you have anything that could help, any type of exercise?
It sounds to me you're talking about the calf muscles behind the leg, the gastrocnemius and soleus muscles.
That is correct.
Okay. Many times the nerves in the low back are being irritated going down the leg, and they cause a chronic type of spasm within those particular muscles, and that can be a painful situation. That's relatively common thing which we see in runners. There is also the fact that the bones in the leg areas, particularly the knee and the ankle, could be out of their normal position, which in turn put additional stress on the joints and the muscles, which can result in that type of pain. There's also a bone which runs along the outside of the leg. It's called the fibula, and that can be out of position. It's a point of attachment of many different muscles, and as a result of which that can be involved. And as chiropractors, we are taught how to evaluate a particular joint and then make the necessary corrections to help get it normal. From what my understanding is, we're going to have a little demonstration here today, and I'm going to be actually giving an adjustment to a patient so you can see the type of procedures we use with regards to problems just like that.
Thank you.
My pleasure. Thank you, Ruben.
Bye-bye.
Okay, and we will get to that demonstration in our second half hour on the topic. We have a couple of minutes before we're going to break to set up for that. I do want to get your phone number out in the first half hour as well as toward the end of the show.
Appreciate that. Should I give it on the end?
Yes.
Okay, it's area code 718-847-5252. My office is the Richmond Hill Chiropractic offices, and we're located in North Richmond Hill. And thank you for letting me put the plug in. I appreciate it.
Sure, and if anyone has any questions, you can email me at feedback@talkingabout.info, and you can find a link to that email through our website, which is www.talkingabout.info. Okay, wrapping the first half of this program, what would you say to someone who's just going through day-to-day life as a guideline for preventative care?
Okay, There are many different things which we can do. We're going to get off the chiropractic right now, and I'll talk about certain things, activities of daily living, which would certainly help you and to stay healthier. One thing, of course, is good nutrition, and that's a separate show by itself. But another thing is proper sleeping habits. A lot of people have a tendency of sleeping laying face down, and that's improper for a number of reasons. Number one, the low back is at a mechanical weakness when a person is laying face down. It kind of bulges in a little bit, and that puts a lot of stress in the low back. In addition to that, if you're in bed laying face down, you can't breathe through the mattress or through the pillow. So what you need to do is either turn your head to the right or turn your head to the left, which in turn puts additional stress on the cervical spine, the neck, in addition to the nerves, the blood vessels, and the joints as well. So when you sleep, there are essentially two different positions which are proper for sleeping. One of which is laying face up. That's a good position to sleep in. Another position is laying on the side. Also, what's very important, particularly with people which suffer with headaches or any kind of neck and shoulder problems, is the pillow. The pillows which most people recommend, most people use, are just regular pillows you can buy anywhere. And they tend to be fusiform shaped, meaning that they are fatter in the center and thinner at the edges. Now, if you have a pillow which is fatter at the center than it is on the edges and you lay face up, you're physically forcing your chin to your chest. I'm exaggerating a little bit, but this is what you're doing, which in turn puts stress on the neck area. There are pillows on the market called cervical pillows. And they have various different shapes, but they all work with the same idea that you want to keep the neck in its normal alignment. Normally, there's a forward curve in the neck, and you want to maintain that forward curve. It's called a lordosis. And these pillows allow you to do that at night while you're sleeping, and they help hold the adjustments which we make in the office in position, but they put the neck at a much better mechanical advantage than a regular pillow does. So sleeping and rest have a lot to do with spinal health and also have a lot to do with regards to holding your adjustments. Also, exercise is very important. Now, there are exercises which we can do which are designed specifically to strengthen the low back. Those are called rehabilitative exercises. And rehabilitative exercises essentially are designed to stretch muscles which are too tight and strengthen muscles which are too weak. But then very important is that we have some form of general exercise, and that we can put into the form of aerobic exercise. And aerobic exercise can be as gentle as just walking a little bit. You can run, you can bicycle ride. I happen to, in addition to being a chiropractor, I also teach an exercise called indoor cycling or spinning. I work at a health club in the morning. That's my thing. I really enjoy that. And it's a very good way of keeping the body in good shape, and that too allows the spine to hold its adjustments better. Good strength to your muscles, good aerobic exercise, and that's another good little hint I like to give to keep people healthy, that everyone should be exercising at every age. There's something to do.
Okay, so I mean, it could be, like you said, just as simple as going for a little walk after dinner, just to get the blood flowing or whatever.
Right. And there are also what I call don't step on landmines. I mean, if you have an object which you have to pick up, that you should pick it up correctly, instead of incorrectly doing it. There's certain things you may need to avoid doing, in order not to hurt yourself. And again, we instruct patients. One of the things I like doing in the office is we have special consultations, which we have a few times in the month for our patients, where we teach them what to do and, more importantly, what not to do so that they don't hurt themselves on the outside. So this is another part of chiropractic care where, again, we educate our patients. Education is very big in the chiropractic profession.
Okay, and this first half hour on the topic has been quite an education for myself. We are going to continue this in another half hour on the same topic, but with a demonstration. And right now we're just going to take a little break to set up for that. So while we're doing that, we're going to let Dr. Cynthia roll. I want to thank you for joining us for this half hour. And stick around. You're going to be here.
We'll be back.
Please don't run away. And back in a minute.
Hello and welcome to Ask Dr. Cynthia. I'm Dr. Cynthia Pizzulli, certified sex therapist, and today we have a letter from Annie, who writes, I hardly ever have an orgasm with my boyfriend, but almost always when I'm with myself and by using a toy. Is there something wrong with me? Now, Annie, this is one of the most common questions that I get asked. Okay, women, as a rule, tend to feel very inadequate if they're only able to achieve an orgasm when they masturbate or when they're using a vibrator. The truth of the matter is, let's just talk some truths, all right? Fact number one, women can only pretty much achieve an orgasm from clitoral stimulation, okay, for the most part, generally. The second fact is that through intercourse, it's extremely difficult to have any clitoral stimulation. So what ends up happening is a lot of women feel inadequate because they're having intercourse and aren't able to achieve an orgasm because there's no clitoral stimulation going on. Now, the good news with you is you know how to have an orgasm. You actually know how to stimulate yourself so that you can achieve an orgasm. The next step now is to be able to tell your partner what feels good so that he can know exactly how to touch you so that you can achieve that orgasm. And you may not necessarily need a toy while you're having intimacy. The big problem is that women tend not to share these things with their partners because they're embarrassed or they don't really think they're entitled to the pleasure, or they're afraid that they'll disappoint their partner or hurt their partner's feelings. But it is extremely important to let him know exactly how you need to receive pleasure. And no, you are not at all weird because you use a vibrator when you masturbate, but you need to do the same stimulation that you do during masturbation when you're having intimacy with your partner. Thank you very much for writing. If any of you have any questions, feel free to email me or write to the address on your screen.
That's it? Yeah, we're ready. Welcome to Talking About. You're watching the second half of a program on chiropractic care. As in our first half hour, we have Dr. David Reich with us, and joining us for the second half hour, we have a special guest, former professional football player.
Yeah, Greg Murphy, former New York Jet, you know, best friend of Willie Randolph, our new Met coach.
Oh, okay. Well, what brings you here tonight on the topic of chiropractic care?
Well, you know, as a football player, I've had millions of injuries. I've had my pectoralis major ripped from my sternum. I had my groin muscle ripped out. And what happened was I met Dr. Rice through some people, and I wasn't able to run. And he performed a minor miracle, you know, by working on my shoulders, working on my knees, working on my legs. I've had knee operations also. So he's done a very, very good job, and he asked me to do it tonight, and I'm here for him. He's a wonderful guy, and he helped me.
Thank you, Gregory.
Okay, and just a breaking topic for just a moment, because as a professional athlete, I'm sure you have a lot of admirers out there. And what is the most common question in that respect that you're asked, and answer it, just so we can get that out of the way so we can stay on topic for the rest of the show?
The most common question that I'm asked as a football player is, how much money do you make? But, you know...
but we're going to be respectful on that.
We're going to be respectful on that. And how many times do you... How do you fall down and get back up and fall down and get back up? And the only way that you can fall down and get back up is if you have a trusty chiropractor on the sidelines to take care of those things.
Nice segue. Okay, Dr. Reich, you're going to be giving us a little demonstration.
I just want to say that Gregory also was the head coach of the New York Dazzles, which is a professional women's football team, and I was a team chiropractor there too as well. So I want to throw that in.
Yes, we had some great girls. They well, we didn't win any games, but maybe this year we'll win some games. But
they played their hearts out.
They played their hearts out for me, and they're beautiful girls.
Okay, well, thank you. And Doc, you're going to be demonstrating, you said the activator method is what you...
I'd like to preface this. When I first graduated from New York Chiropractic College back in 1981, we had learned at least 12 to 13 different types of chiropractic techniques. And even to this day, the vast majority of chiropractors use diversified procedures, which are typically techniques where you hear the popping and the cracking and that type of thing. And I used that for a number of years. I had a whole hodgepodge of techniques. And one weekend I was attending this convention in Florida, and one of the seminars was given was an activator method. Now, I heard a little bit about it. Activator was kind of in its infancy at that particular time, but I said, hey, I got 8 hours to spare. Let's go to it. So I went to the seminar, and I found it extremely interesting, and I started incorporating it into my practice. And I was very selective. It's what we call a light force technique. So I was using it on people I didn't want to use a lot of force on: senior citizens, osteoporotic patients, children. And I found I was getting not only good results, I was getting very good results, and the patients not only were satisfied, they were enthusiastic. A lot of times patients would say, you know, doc, I never really liked it that much when you cracked my neck, but I really like you using this instrument because it doesn't hurt, and I seem to feel better than I was feeling when you were using the other technique. And then over the course of 2 or 3 years, I wound up incorporating it, that it's my major technique in practice at this particular point.
Okay, as with differing techniques, sometimes new things and techniques can have some controversy around them. Is there any with this?
Well, when I graduated school from college, chiropractic college in '81, Activator was just coming of age. And at the time, you couldn't use an activator in the clinics treating patients. It was not taught in the school, and there's controversy. And even to this day, certain chiropractic colleges do not teach it. But still, the vast majority of chiropractic colleges do teach it. It's a major technique. And in my opinion, and that's the reason why I do it, I personally feel it's the best technique to use, at least for me. And I hope that other chiropractors out there who are will use whatever technique they're using, feel that the technique they use is the best technique around, and it's the best for them. So personally, this technique fits me very, very well. I enjoy doing it. It's a very analytical technique. And the good news is it's very gentle, and I can treat a lot different problems which I couldn't treat using other procedures. I can have a patient come in who can barely walk, and if we can get them onto the table, I know they're going to be better walking out. A lot of times we'll have situations where I'm going to get a call in my office, and the story is, this is the wife of the patient calling, and they can't get out of bed. And with the activated technique, I can go in with a portable table like this, or I have what is called a prone cushion, and I can go right into their house, lay the cushion on the bed, and give them an adjustment right there, and you do a very good adjustment because of the activated technique. So there are a lot of advantages to it. This is an activator and adjusting instrument. It produces a force of 30 pounds per square inch in 1/300th of a second. And the 30 pounds per square inch is a sizable force, but what really makes the difference is the speed of it. It happens in 1/300th of a second. I brought a little demonstrator here. I don't know if you can focus in on this. Can we zoom in a little bit on this? Is that possible?
Okay, yeah, we'll get that.
Okay, I just want to show you how it works. This over here is nothing more than a marble in a plastic tube.
And just hold it in one place so the camera can get focused in on it.
Okay, good.
And
now I'm going to show you that by firing the activator, we can cause it right through the hard plastic. We can cause that thing to shoot up even in the air like this. Sometimes it can go all the way to the top. But it shows you how the force is actually going into the body. Now, I promise you, the bones are not shooting 3 or 4 inches when we adjust it, but this is to demonstrate there is a significant force coming through this instrument, even though a patient will feel it's very gentle, and they're going to walk off the table saying, did you do anything to me? But when they get off, after a while, and they start feeling better, they know I've done something for them, beneficial. So that's what the activated technique is about. And the developers of the techniques was Dr. Warren Lee and Dr. Arlen Four. Dr. Lee seemed to retire, but Dr. Four has done a beautiful job of getting this technique out internationally. And this is the largest light force technique right now available in chiropractic. There's been tons of research. As a matter of fact, the activated technique was the first technique which was given a National Institute of Health grant to do research. So there's a lot of research in it.
And we're going to get to the demonstration, but we do have a call first at 718-460-9802. Caller, speak up whenever you're ready. Or did we lost the caller, but 718-460-9802. 9802. Why don't we get to the demonstration?
Okay, fine. Now, this particular table, this is a portable table. In the offices which I have, we have special tables which are high-low tables, which go from an up position to a down position. They're motorized. So I'm going to ask Gregory to lie face down on the table. Gregory's a big guy, and this table actually holds him very well. Okay,
Well, yeah, that's a good thing because we don't want to cause any more damage.
Now, I don't know if the camera can really look in this, but if you want, I'll wait a second to see that we get a good angle. What I'd like to do is I want to show you a few things and how I work here.
Okay.
First thing we like to do is we like to look at the bottoms of the feet over here. And if you notice over here, what we're looking at is Gregory has a right short leg and a left long leg, and that's called the right pelvic deficient leg. That does not mean that the bones themselves are shorter, that the right side is shorter than the left side. What it usually does mean is that something in the lower part of the body has twisted out of its normal position. Certain muscles have tightened up when they shouldn't be. Other muscles are looser when they shouldn't be, and as a result of which, it gives the appearance of it being a short leg. It's what we call a functional short leg. The next thing I do in the procedure is I bring the legs up to 90 degrees. And at 90 degrees, we can see here that they level themselves off. So that tells me that we have something we need to do in the pelvis to correct, or in the knees. So the first thing I'm going to do is test the knees to see if they need to be adjusted. And this is just one part of the knees. There are other corrections we can make on the knees. And there seems to be no issues with regards to the knees. Next thing I'm going to be doing is testing the long leg side of the pelvis to see if there's a change, and there isn't. And then the next thing I'm going to check is the short leg side of the pelvis by pushing up on the pelvis. And when I did that test, we noticed that the legs balanced out. Now, this is a reflex, and it lasts about 7 seconds, but during that time, it tells me that that something needs to be corrected. So what we're going to be doing is we're going to be making 3 corrections on the right side of the pelvis. 1, 2, and 3. There is no pain associated with this type of adjustment at all. What happens is now the legs are even. We're going to check it again by bringing it up to 90 degrees, and I'll even go a little beyond 90 degrees. And we find out that they're still even. Now, what we've gotten at this point is we've leveled out the pelvis, but there's still another 24 bones we have to check. So I'm going to ask you, we're going to put the patient through what's called isolation testing. Put your right hand on your low back, please. Now we're going to check the leg lengths. And this is a test right now with a hand on the back for the lower lumbar vertebra. Put both hands on your low back. This is the middle to upper lumbar vertebra we're testing.
And are these common conditions?
Oh, very much so. Left hand down to your side, right hand up over your head. What we're checking for now is we're not checking for conditions. What we're doing is we're checking the spine to see if it's properly aligned. And what we're doing is we're checking every 2 or 3 segments, right hand down. Those segments which are more commonly misaligned than others. But that doesn't mean other segments are not misaligned. Left hand over your head. There are a lot of other tests we can do using this procedure to really fine-tune the spine. But right now, what I'm doing is just a basic scan of the spine, left hand down, please, to determine where the major misalignments are. Put both hands over your head. Right now, we've checked out about half the spine at this point. Right now, we're checking the 8th thoracic vertebra. Put both hands down now and turn your head to the right. Right now, we're checking the 6th thoracic area. And it looks like we might have a bone out of position right here. If you notice, everything was even before, but now the right leg went short.
All right, well, that's a little difficult to tell from the studio, but...
But that's what's happening.
Exactly.
John will be my witness. Okay, and now it was short when the legs were straight, but now when I bring it to 90 degrees, they level off. And that tells me we have a 6th thoracic vertebra out of its normal position, happens to be out of position on the right. And we're going to go to that bone and make a correction, and then go to the rib on the opposite side and make another correction to help bring it back into alignment. I'm going to recheck the legs. They appear to be even now. This is how easy it actually is. It's very gentle. Bring your right shoulder back and down. Right now we're testing the 4th thoracic vertebra. I want you to shrug both shoulders up, down. We're checking the first thoracic vertebra. There are 12 thoracic vertebrae. Squeeze your left elbow to your side. Relax. We're checking the scapular or the shoulder blades and the arm. Squeeze your right elbow to your side. Relax. We're checking the opposite side. I want you to return your head back to the center. This is a test of the 7th cervical vertebra, which is the last of the cervical vertebra. Lift your head up, please. Down. We just checked out the 5th cervical vertebra, and we found another bone out of position. So far, we've corrected the right side of the pelvis, the 6th thoracic vertebra on the right side, and also the 5th cervical vertebra. The 5th cervical vertebra is a very common bone to see out of position, particularly with migraine headaches, shoulder problems. You know, a lot of stress in the upper neck area is a result of having the 5th cervical or the 6th cervical vertebra out of its normal position. Good. And I want you to tuck your chin to your chest, back in the center. And there's a bone out of position there as well. And it's the 1st cervical vertebra, and we're going to be making an adjustment to it.
Okay.
And this is the basic technique, and this would be a basic adjustment. There are other things I can do, but for demonstration purposes, this is the adjustment.
Okay, which was basically, you just answered my next question before I asked it. But is this something that, in general, a patient might experience on your table?
Is there something a patient will experience?
Is it in general? I mean,
a lot of times after an adjustment, okay, a patient will have a reduction of pain. That's one of the things which we see. But a lot of times a patient coming off a table is going to feel a sense of relaxation, that they may feel very, very stressed before they come on the table, and as a result of us correcting the problems in the nervous system with the adjustment, they walk off the table feeling like $1 million. They're feeling distressed as a result of it, because we are working directly with the nervous system.
Right.
And you know, sometimes people's nervous systems are really wound up, and this helps unwind it, helps relax it.
Okay. I mean, yeah, I'm sorry to try and make so many broad generalizations, but for the purpose of just
got a big
little
audience
show,
over
and
here, you know,
exactly, we want to help as many people as possible. Patient still awake?
Yeah. And craving chocolate.
It's that time of month, right, Gregory? Okay.
Okay, and I do want to remind our callers in the last 5 minutes of the show that we are taking your calls at 718-460-9802. Any questions you have on this procedure or on chiropractic care in general. Okay, during the first half hour, we talked a little bit about just daily maintenance and prevention. Somebody's already been to see you. What can somebody do who is under the care of a chiropractor to stay out of pain?
Okay, well, one of the things, of course, is that I ascribe to what we call preventative maintenance care, which means coming in once a month and recognizing that you're coming in once a month or so because of the fact that your life is constantly being stressed. You're getting in and out of the car. You're talking on the phone like this. Women carry pocketbooks. You tend to use one side of the body more than the other, so you want, as a way of prevention, of getting adjusted regularly. But then again, you want to do things like eat right, exercise, the things which we had mentioned earlier, as a form of prevention. There are also very specific exercises we can do, spinal exercises, which help balance the spine out, which allow you to use muscles on the side you typically don't use the muscles, to help give balance to your spine. That's another good way of preventing problems as well. So there are many different philosophies and different protocols which we can ascribe to help keep the body healthy. See, my job as a chiropractor is not to make my patients fixtures in my office.
Right.
My job as a chiropractor is to get them better, keep them better, and more importantly, teach them what to do and what not to do, so they don't upset on the outside what I'm trying to accomplish on the inside.
And we do have a caller. Caller, whenever you're ready, join the conversation and speak your mind.
Hello?
Hi.
Yes, hi. My name is Boris. I've actually, I'm 27 years old. I had some back, I'm bowling a lot, and I've had a lot of back pain, and I was going to an office, and I've been seeing a chiropractor and a physical therapist, and basically, physical therapist was doing like a heating pack, electrical stimulation, massage, and some mobilization, and chiropractor was just adjusting me afterwards. Now, do you advise that I continue doing that, and what's the difference between the two? Because when one wasn't there, the other one was doing pretty much the same thing that the first one was.
Well, you're talking about the physical therapist doing the same kind of work as a chiropractor was doing?
A chiropractor was doing, like he was applying, when the physical therapist wasn't there, he was applying the heating pack, the electrical stimulation, doing the massage. And when the chiropractor wasn't there, the physical therapist was doing more, like he would do more mobilizations, like, he would stretch me a little more, same thing like the chiropractor would do.
Well, the PT, the physical therapist, would probably do mobilizations with you and range of motions and exercises, whereas the chiropractor's job would be to examine your spine each time you come in, looking for subluxations, and then making the necessary corrections as well. So both the PT, the physical therapist, and the chiropractor, working in conjunction with each other, should produce the best results.
Oh, so I should continue doing that?
Certainly, certainly you should.
All right, thank you very much.
We work very well together as a team.
Thanks. Bye.
Okay. And we're coming toward the end of our program already. Time flies.
When we first talked about it, and I said, an hour, what am I going to talk about for an hour? But it just flew. I want to thank you very, very much, John, for giving me again this opportunity.
Well,
thank you,
yeah,
Gregory.
I want to thank both of you for coming.
Good job in craving chocolate.
Thank you so much. I'm a well-adjusted person. Just say no to drugs. Go to chiropractors.
Okay. We've got our moral message for the day.
Yes.
And your phone number.
My phone number is area code 718-847-5252.
Okay, and there will be some links on our website. Give me a little while to get them up there. Some time to get home. www.talkingabout.info, or you can email me at feedback@talkingabout.info, and I'll give you that number again. And I want to thank you both for joining me.
John, thank you so much for having us. I really appreciate it.
It's been you're welcome. And I want to thank you, the viewer, for joining us on tonight's episode of Talking About, and I will see you again next time. Thanks. Good night.